left is the chairman of the board, Professor Adebukola Adefule Oshipelo. The chairman is an ophthalmologist that for several decades. We have Alaja Amuinot Agbalaya. She's a herbal product seller. You have Dr. Bayo Akiposola. You have Prince Mary Tajudeen Olushesi. He's also a renowned TPA. You have pharmacist Bayo Gubadijo. You have Otuba Sulaiman Ayinde. Well, the Board of National Medicine is a board of 11 members. Some of them are not here today due to one reason or the other. Because we had an event yesterday and we were very busy. Now going back to Milyash. Milyash came to the board in the year 2019 to apply for registration as an alternative medical facility in the state. And I could recall that when they came, they were forced to start this facility where we are standing here today at a place around Aja Axis. They took a very, very massive structure, and I know they've gone into the stage of doing a lot of reconstruction. They were about moving into the place. I don't know what happened, something else happened, and they couldn't move in there. Then we didn't have a board. But to the glory of God, in the year 2020, to be precise, January, the state governor, Mr. Babajide Sanwo-Olu, constituted the board of governance for Lagos State Traditional Medicine Board, and today we have the board. We are very privileged to be one of the 5 boards constituted by the governor in the entire health sector. Now, sometime this year, Milyash came back again to let us know that they found a new place, which is where we are currently today, for the development of their facility, and we came on inspection to look at the place. Actually, what I want to commend Milyash for is they followed all the guidelines, because we gave them all the guidelines. We have our guidelines before we could even approve that this place could be used as an alternative medicine facility. And they did all the needful, paid all the necessary fees, did all the needful, the first inspection, second inspection, until the facility became what it is today. To all of us seated here today, we can still that there's still a lot of work ongoing within the facility. But we are proud to associate ourselves with the board of Milyash today for opening this facility. And let me put it to you today that Milyash Alternative Medicine Facility is the first alternative medicine facility that will be registered by Lagos State Traditional Medicine Board under the category of alternative medicine practice in the state. Let me also brief you that from next year onward, it's a national directive, and the Lagos State government is currently reviewing our health sector reform law. And what that means is that at the national level, all states have been mandated to go and establish the Department of Traditional, Complementary and Alternative Medicine. But Lagos always leads, and we have started already. So from next year onward, all alternative medicine facilities in the state will have to get registered and licensed by us before they can run their practice in the state. So I want to say congratulations to Milyash for being the first of its kind in the state. You are the first that we are licensed, and we are proud to be associated with you. Without taking much of your time, I'd like to hand over the microphone to the chairman for her to give her own brief speech and also to declare this place open, your facility. Thank you very much, everyone.
And I'm so happy and proud to be around here. I'm so happy to be associated with this kind of development. And first of all, give glory to the greatest physician, which is the Almighty God. We thank Him. I think when you came in 2019, it was a bit premature. It was waiting for people like me to come and join you. When the board would have been set up, we thank God for this. So we are so happy. We are congratulating you for having this great thought to come to Nigeria despite all odds going on right now. But we reassure you that as traditional medicine has just been incorporated into the healthcare system, we want to say you are helping us in pushing this ahead. Because just 2 weeks ago, we had the acupuncturists who came to join. And then the Nigerian Council of Physicians also came. So which means, it's just the right time that things are setting themselves into place. Like the jigsaw puzzle, you've taken your own space in the jigsaw puzzle. And we pray that as we are going to commission this today, you have a boom. You have a boom in, seeing the patronage. You may start small, but you see it expanding. And, to the glory of God again, you won't regret it. We give you our full support. And I tell you that this is a breakthrough. It's a huge breakthrough. Because I'm so happy you are the one doing it. This is not just the color of our skin. I don't know, people downsize us, reduce us to everything. But seeing you that you now see that you are now telling us we are worthy. And that's why you're here. So we appreciate you for that. And is a role model for the others. Somebody has already started, has already gone. We have so many branches, setups all over, but none of them has been bold enough like you have done to approach us and to join us. So you are welcome, very much welcome. So we say, a jolly good fellow. By naming you that, jolly good fellow, to join us here. And the rhythm and the music of traditional medicine practice will now take a fuller representation, because already we know, and the government herself knows, that at least 70% of our population still consult the traditional medicine in their various specialties. And so that you are doing this, that you are the first one to come and register, and with the established hospital already, I think we give you a round of applause. Thank you so much. I'm not going to talk too much. I think I've done enough. I just say once again that a very warm welcome we offer you, and that you will never regret it. We too will never regret it. Thank you. You are welcome.
Yeah, please let us welcome with a round of applause. So he's going to give us a brief before we now invite the MD of this clinic. So Mr. Apia.
Thank you very much, Mr. Ayo. I think our registrar has done a very good job on the background of our emergency. Milyash started in Ghana as a network marketing company affiliated to a full-grown alternative healthcare center called DAMID in Accra, Ghana. When Milyash started, we realized that a lot of Nigerians, especially from the north, were commuting to Ghana to come and buy the products and come and distribute them here due to the efficacy of the products. So we realized that we have to make our presence known in Nigeria, so as to reduce the burden of our customers who travel all the way from Nigeria, especially Onitsha, to come and purchase our products. So 3 years ago, we decided to establish here, and we did all the job. As the registrar said, today we are here. But we are here not as a network marketing company, but a full-blown alternative medicine center affiliated to Diamond Diagnostic Center in Ghana. I will not speak much because time has already gone. We need to make things short and move on. Without much ado, I would like to welcome our medical director, who is also the medical director of Diamond Medical Center, to give us a brief speech. Dr.
General Register, the chairman, all professors, and everybody who is just supporting and make possibility to make and open this place. We are so grateful to you for your great support what you are giving to us. Of course, this not easy situation now that everything is moving not easy. To open the place from the zero and let the place go up and successfully, it is a very hard work. And I am telling thank you for all the group of people, all the engineers who work here, all the workers, plumbers, electricians, the people who did furniture and another. We are so grateful to them. And together, I want to tell that why our place is alternative medicine. Because we know and notify, like a lot of hospitals around, and most of the people prefer and participate in traditional herbal medicine, like a nature. They could create us like a nature and part of the environment around. We're supposed to appreciate and follow. If the God create the disease, we have a natural cure of it. And this is all traditional people know about it. But our target to combine the knowledge, which is done through the all investigations, which is just going through the university in Ghana, Kumasi University Science and Technology, Kwame Nkrumah University Science and Technology, Pharmacology Department, who help us to make all the investigation, very deep scientific investigation about our product, which is going to treat uterine fibroid. This is the 70% of reproductive age woman has that problem. And our herbal medicine, our herbal product, it is especially shrink and dissolve the fibroid, and it is scientifically confirmed. This is make our place is famous and make our place non-competitive. This is why we are just going and we are praying that the success in Nigeria will be followed together with us. Alternative, it means not only the medicine. We're supposed to just check and care all the people who is just coming for the treatment. First place, it is a diagnosis. Need to do laboratory test, need to go for the scan to see how is the process is going. We're supposed to look for the roots of the disease. We shouldn't treat the side effect, like hypertension, for example. Hypertension, it is a side effect for some of the diseases, like bacterial infection, which is entered to urinary tract, affected kidney, and like side effect coming hypertension. For kidney disease, no any pharmaceutical medicine which can cure the injuries of the kidney, which can cure kidney conditions. Only herbal medicine, our herbal preparation, renal tea, which is just regenerate the kidney tissue. And we recommend for the people which is just stay on the dialysis and will help to reduce number of the dialysis and just regenerate the kidney, that stop dialysis complete and kidney regenerate. Of course, we must tell that we are not a god, and if the kidney is failure complete and it's not possible regenerate, we couldn't do anything. And we are just telling everybody, take attention for your health before you go to the hospitals, and if you use any of the orthodox medicine, like pharmaceutical allopathic product, you're supposed to understand that all of them, painkillers, antibiotics, another medicine, it is affected kidney system. You need to take attention for it. And I advise that everybody can come to our place and just twice in a year check your kidney, check your liver, check your heart, blood vessels, digestive system, because this is make diseases and weakness of the body. To know what is caused, what is the root of the problem which is just make you weak, need to come to our place, do the complex of diagnosis, find what is the roots of the disease, and treat and kill the roots. And all side effects go themselves. And this is only together with the natural and herbal medicine. We accept that antibiotics is working faster than herbal. We accept that people who is just make a science and research about saving the people's life, like emergency help, to stabilize the critical conditions. We're supposed to go to the hospital and make orthodox treatment, which is just all the doctors doing. But the treatment for the long period of time, treatment of the chronic diseases, it can be possible only with the herbal medication. And we are traditional and alternative medicine practitioners here. You are welcome to our place. We are located at 32A at the Tecumba Adenoa Street at Victoria Island. At the Tecumba Ademola Street. Thank you. Thank you, everybody.
About this speech, it shows that you are a true alternative medicine alternative medicine practitioner. So I think we just go straight to the commissioning and we take our leave. So, Mama, you have your scissors so that Mama can dedicate it to the glory of God.
God the Father,
Amen.
His Son,
Amen.
and the Holy Spirit.
Amen.
We declare this dedicated to Him.
Amen.
And healing galore, patronage galore.
Amen.
Father, take all the glory.
Amen.
Congratulations.
Thank you.
Mommy.
Let's go.
Yes.
You are coming. You are welcome. Welcome, everybody. Let's go. Let me just give you the introduction.
Don't need it again.
Okay. Now let me introduce that everybody who is coming to our place, we use for registration and management the place, we use paperless computer system. And reception start, it is the first place where the people go in to register, check their blood pressure and make their complaints. After the complaints and registration, people go in to see the doctor, and we are coming for the hour consulting room. Tell them to stop the room. You can see like this is a waiting area for the people who is just coming after registration. And this is our consulting room. Where the doctor just everything which is necessary, prescribe the laboratory test and stuff. After that, we are just patient is going for the analyzer to check and see what is going on with the blood, to see conditions of the kidney, to see conditions of the reproductivity of the erythrocytes. We know like full blood count can show a lot of things. Inflammation, all the process what is moving there. Then, if it is just done with the blood, we can see and do the chemistry analyzer. We are doing like reproductive hormones. We have hormone analyzer, full complete automated. We have chemistry analyzer, full complete automated. And we have 5-part hormone, 5-part hematology analysis. That 3 big machines which can just help us to make a correct detection of the problem. We have additionally the scan. we can go and see the scan room, that we have a scan, ultrasound scan with the 3D, 4D, just to see and know what is going on in the pelvic part, in the abdominal, to see kidney condition, liver, to see what is the sizes of the fibroid, and to see the dynamic, to notify how the fibroid is shrinking and how, if the people has the problems with the reproductivity. For example, female, if the blockage of the tubes, we have a special herbal medicine together with the shrinking fibroid to open the spike, the cumulative tissue inside in the fallopian tubes, to open it, that the egg can be easily moved inside, and especially to fertilize the egg. During using our herbal medicine, the people boosting fertility. It is helping, like gonadotropin release hormone, to produce gonadal hormones. It means sexual reproductive hormone. It is stabilize the thickness of endometrium. It is open fallopian tubes. It is boosting and helping to produce all the fertility hormones, lutein hormone, follicle stimulated, all the what is necessary. Everything is just producing and boosting female fertility. If the lady has a goiter, a lot of people has a deficiency of iodine and different things. We have a special herbal medicine with a huge quantity of iodine, which is during 3 months can help dissolve completely the problem with the thyroid issue. The goiter will be disappear. We invite everybody who has that goiter problem come and participate natural herbal medicine treatment. Scan will show and help us to detect how the shrinking is coming, how the fibroid tissue is dissolving. Just this is a briefly. Additionally, we are doing treatment for the spinal problems. People who has disc herniation at the spine, it is a compression, giving the disc herniation. Just the nuclear pulposis, just moving out and affect it and make nerve inflammation. This is radiated to the leg. This is make bending and pulling and another things. People spending years going to different centers, trying to dissolve the problems, but it is the same. This is a physical point. You need to use physical therapy for it. And that physical therapy course, special methodics, how we can just dissolve it together with the medication, we have all that during 1 month, people can be dissolved that problems, if they follow only our instructions. Because most of the people, they think I swallow tablets, everything will go themselves. I went to the chiropractic center one day, it is enough. No, this is a matter of physical issue. If, for example, big stone fell down to the leg, and you swallow the tablets, painkillers, how this painkiller, herbal or chemical, pharmaceutical, no, never mind what, how the stone can be moved from the leg out. This is need to do physically. The same, the stone, which is just make you pain, it is inside in our spine. Compression. Maybe you lift something heavy. Maybe you carry something heavy. Ladies just carry the babies all the time. Carry the luggage. Everything make compression. This compression, we have special equipment to stretch it naturally. If you do it 1 week, 5 years, forget the problem. If you are doing 2 weeks every day, 10 years, no problems at all. We are make and help the people who has disability, to help them wake up again and go and move. We have a solution for the people who has stomach ulcer, who is just complain that they have a belching, they have reflux disease, they have a different diseases, gallstones, people with the acute pancreatitis. And I want to notify, because it is a lot of people doesn't know, that diabetes type 2, it is a side effect for the acute and chronic pancreatitis. It is a scientific research in the world was done and need to take attention. If you want to prevent diabetes, you need to care about your pancreas. To protect pancreatitis, need to care about gallbladder. And only this digestive system can cure at our place. Welcome to our place, and we are so happy that you are coming to participate, and together with your support, we are just growing together up. We invite all practitioners who is interested. If you need to do some of the lectures, some of the course of the education, I am open with the open heart. My education, it is for society. Thank
Thank you very much. We need your pamphlets.
Yes, please, we have them. I think
we are plenty, so she may not even know that she didn't come. I know she will know, but it's not the
let's go and see the. Where is our pharmacist? Please let people will come. Just 10 now, and seven additionally is pending registration. When they finish registration, we will import it. This one is registered already. This is everything done. The product for the fibroid. Just I show that this is a fibroid product, working like gonadotropin release hormone, shrinking the fibroid, every type of fibroid, never mind the sizes. As soon as bigger fibroid, the view of the shrinking will be more effective. This is what we have. We have product for the thyroid, how I discussed. This is a product with a huge quantity of iodine. We have a product for liver. We have product to treat hypertension and another. We have a different product which is just treat different diseases. We have product which is boost the sperm count, sperm motility. That the man, mostly African man, all the time thinking that the problem is with the woman. It is not a man's side, it is a woman.
They are now knowing.
But let me explain.
They are now knowing.
Let me explain that in my investigation that the problem with the low sperm count, it is give number one in the young age receiving urinary tract infection, which is affected the scrotum. It is a different diseases and bacteria like staphylococcus, streptococcus, different type of the E. coli and another, which is just trichomonas chlamydia, which is just affected the reproductivity. Additionally, need to understand that congestion, like the blood is poor circulate at the pelvic part where the scrotum is. The heat inside, it is just affecting the reproductivity of the cells which supposed to just go and fertilize the egg. It is make all these things is very poor. We have special this herbal medicine which is boosting it, and additionally we use special physiotherapy procedure to just to increase the blood circulation at the pelvic part, and for the scrotum to dissolve the spike in the seed duct, and it is helping to reproduce the seeds again. Additionally, problem and the product which is just helping to shrink the prostate enlargement. Prostate enlargement, it is a side effect number one, bacterial infection, inflammation, prostatitis. This is know everybody. When the people don't care about it, they start think that maybe business, maybe some another issue, just lack of the sexual activities. This is just prostate producing liquid, but it is not ejaculate out. And this is continue grow bigger and bigger, the prostate. We have special physiotherapy which is just boost the blood circulation there, increase the production of testosterone, and helping to have ejaculation, like erection and ejaculation. This is a part of the treatment of erectile dysfunction. And I want to notify the people who is thinking that erectile dysfunction only if you swallow the tablets and it is boost your erection. It is not true, because all the signal coming from our brain. Inside in the brain go in production of the hormones, and the hormones are supposed to come to our blood, to the reproductive organs. This is the one thing. The second point, it is a center when neurostimulation coming about erection. Visual stimulation when the man see the woman, and just the neurostimulation from the brain through the spinal cord coming down part to erection. But what is happening when the people has a back pain? This is the wires which is connecting brain to the erection through the spinal cord. Has compression. And that bias is breaking. Signal is not coming. No erection. And the people use bucket of the medicine. Trying different medicine. It doesn't help. What is necessary to do? Need to treat spinal problem, need to treat bacterial infection, and need to boost productivity of the testosterone and use our medicine to shrink the prostate down. We have this medicine, Metaprost. This is especially to boost productivity of the prostate, production of the testosterone. And testosterone, it is make male activities that the man stay active. They are powerful, together with the vitamins and minerals, which is just coming from this huge iodine. I can talk a lot that we are doing treatment for the tumor, for the cancer, for different things. We have a medicine which is treat any cumulative tissue, even the huge scars, tumor, everything, with the combination of that medicine. Antioxidant. We are done both together.
You need to give us the list of these drugs, my dear. We'll get them. We'll get the list and
Short interview.
We are pushing that. Just
Professor Adebayo, if you should tell me. As I said, listen to what I said, it's a breakthrough. We need it. She's the first one coming boldly to come and register under the traditional medicine board. And exactly WHO definition includes alternative and complementary medicine under the tradition. So she's the first person coming out boldly to register, to comply with the WHO definition and stuff. We are very impressed, we are very happy, and it's a breakthrough for us. It's going to be a role model for others to come. And I'm sure doing this will also encourage others. She's opening the door for them. We encourage the others because we have so many of them, practicing without license in Lagos State. What they cannot do in their countries, they are coming here to do. And some of our own people to are doing the same. But with this, it's an eye-opener, and we hope we'll be able to go around, with our task force. We'll be able to go around and, visit all other facilities. First of all, invite them. And those who refuse to comply will have to face, the law. Because there's a law already of Lagos State, reform law of 2006. So that is my final.
Get an name again.
Sorry, my first name and last name. Just one name and the last name. No, I want the first name and the last name.
Adebukola.
Adebukola what?
Adefole Oshitel.
Elated and excited that we're having this kind of facility. She has told you that it's a model, it's a first-class facility, to be honest with you. You've taken the bold step by being the first to come out, to come and register as the first alternative medicine facility in the state. And I can tell you that they followed all the laid down guidelines, and they also followed all because we have our own stipulations of what should be a traditional medicine facility in the state, and they have really complied with it. You can see, you need nobody to tell you, this looks like even an orthodox medicine facility. And even you yourself will be very proud to associate with them. So, and we only pray that they will continue to make giant strides. This is the first facility by the grace of God, we shall be counting many of such facilities in the state belonging to Milyash. That is our own prayer for them. Thank you very much.
It is fully alternative.
Fully alternative.
Nothing to do with
orthodox. Nothing.
Your name, sir?
My name is Kadiko Lawale, the registrar of Lagos State Traditional Medicine Board.
Thank you very much.
I'm alternative medicine practitioner from Diamond Diagnostical Center in Accra, and today we are just launching and opening our place which is affiliated with our company in Nigeria. This is the first place in Lagos State, Milyash Alternative Medicine Specialist Clinic, which is located at 32A at the Tukumba at the Mola Street at Victoria Island. You are welcome to our place, and at our place we are doing treatment of mostly all reproductive issue problems, especially the ladies who has uterine fibroids, ovarian cyst, some of the issue with the reproductivity. We are just doing the treatment or full diagnosis and treatment with the herbal medicine, which is helping to shrink the fibroid, dissolve any type of endometriosis, and it is boosting fertility. Who has a problem with the infertility, with the fertilization of the egg? You welcome all your family, like male and female infertility. People who has a problem with the digestive system. If you just hear what I just explained and tell, a lot of people has a kidney injuries when they use some of the painkillers. If it is just a spinal problem, if it is just problem with the stomach, we are always take painkillers. And nobody just understand that every tablet of the painkiller affected and give injury to the kidney. We have a special herbal medicine which can regenerate the kidney function after using that medication. We are giving that medicine to the children. We are giving to the adult people. And everybody who has a problem with the spine don't understand that this is a physical issue, that need to remove the compression to the nerve, which is just coming during our life. You have a compression and it is start radiated to the leg, it is start radiated to your toe, it is giving pain. Ladies just always feeling the pain when they are carrying children and going around with some of the heavy goods or something. We just have a solution. This is a physical therapy to stretch the spine, open the nerve that it will be functioning well, and special exercises to fix the problem which is just caused it. People who has problem with the knee, it can be result of bacterial infection. Everybody hear about arthritis, but nobody understand how we need to cure it. And at our facility we have a solution that need to treat bacterial infection and need to follow the diet. This is very important because a lot of problem in our body coming like result of the lack of metabolism. We can have bacterial infection inside in the gallbladder, which is affected that the bile secretion is not coming enough to digestion. And the food start digest not complete, enzymes is not producing enough. And the food, a part of the go inside to our absorption to the body, it start deposit like crystals. It can deposit inside in our joints, it can be deposit in the gallbladder, it can be deposit in the kidney. And what is just very popular, this is a deposit of the crystals at our knee, inside in our spine, inside the neck. We are all sitting and chatting on the phone now. We are all sitting and working with the computers. And man always sitting, driving, office, driving, again, sitting, sleeping, that we have a lack of the physical activities. And poor circulation at the pelvic part can cause the calcification and crystallization inside in the prostate, which is make erection low, testosterone is coming down, man start feel like always weak and want to sleep. It is just give erectile dysfunction, make enlargement of prostate. We have solution for all that things. We are doing physical therapy, we are doing herbal medication, we are doing special treatment with the physiotherapy devices, which is help to shrink the prostate and help to boost erection to come and functioning normally. We are not giving one tablets like Viagra. We are giving you complex therapy with the metabolic processes to stabilize and normalize. This is mostly who has hypertension, who has different problem with the bones, joints, who has stomach ulcer. If I will tell everybody to treat stomach ulcer, it is just 7 days. But to keep result, it will take some of additional power because you need to follow instruction and you shouldn't eat a lot of food. To give chance for the stomach regenerate complete. When we are just carry our baby and the baby is small, We start teach the baby after breastfeeding how we need to digest the food. The same happened when the people has a stomach. Stomach itches a wound. Gastritis itches a cracks in the stomach. When it is happening, a lot of bacteria entering inside and start develop the ulcer. And together with that bacteria, it is a lot of different bacteria assimilated with them and coming together. This is what is make difficulty to treat it. And need to follow special diet, follow the recommended together with our doctors. The second need to take our herbal medication, which will help to kill the bacteria inside in the wound and inside in the stomach, seal it, and after the seal, all the ulcers will be just dissolved. We have a very powerful treatment for the people with the thrombosis, physical therapy, which is blasting thrombus and helping the blood flow normally. Who has thrombosis in the legs? Who has diabetic foot? We are doing treatment for that people to boost the blood circulation and metabolism, which is help to dissolve the wound on the legs. We are doing treatment for the neck problem. People who is after stroke regeneration and helping a lot of things to reactivate and just to put them up again. We are doing a lot of diagnosis before we give correct diagnosis. We use laboratory with a hormone analyzer, with a full blood count, with the chemistry analyzers. We do full checkup. We invite everybody, we invite organization, we invite the private people who likes to come. Welcome to our place. Alternative medicine specialist clinic Milyash at Victoria Avenue.
Okay, so how long does it take to treat uterine fibroid? How long does it take and how often the wait is?
Treatment of the uterine fibroid, pieces depend of the size, number one. The fibroid growing like a complex of different hormone imbalance. To balance the hormones, which is very difficult, because before people come into us, they try a lot of different herbal medication already. And that herbal medicine, it is boosting fibroid grow again. Now we are staying in the pandemic time, COVID, and a lot of people want to boost the immunity. Together with the herbs, which is just like ginger, turmeric, it is boosting fibroid grow again and growing faster. They're supposed to avoid that, especially these herbs, because it is a natural product, and follow all our instruction. And the treatment, it is we advise to use medicine during 3-6 months. Come to our place that when you take the medicine, you should use it non-stop, because the hormones, if you break the medicine, hormones just imbalance again. You need continuously take 3-6 months, and the fibroid will be dissolved completely. But need to understand that all the problems which is cause fibroid supposed to be dissolved too, because we are working for the roots. You are welcome.
Thank you very much.
My name is Thomas Apia. I'm the marketing manager of Milyash Alternative Medicine Center in Lagos.
So you tell us how affordable are your products are?
Well, as I always say, affordable. The word affordable is relative, depending upon who is looking at it. But our products are quite affordable because if you look at the cost of production of organic products and you look at the price we put on it, you realize that our products are very, very affordable. Unlike those of the pharmaceutical, of course, those ones are cheaper, so people prefer those ones. But I can assure you that there's no pharmaceutical product that does not leave you with a side effect. So the side effects will also cost you a fortune to deal with. So if you are looking at it in that sense, you realize that our products, like all organic medicines, are very, very affordable.
Okay, I have another question. Some of these, because you have drugs to sell as well, and as in, are they how accessible are these drugs? Can we find them in just any supermarket around the world? Anything that has to do with it, people must come to your clinic here before they can get anything.
Drugs are drugs. There are some drugs which are injurious, people don't know. So if you just walk in to any drugstore or pharmacy shop to go and buy it.
I'm talking about your product itself.
Yes, our products are without side effects. But for them to be very effective when you use them, someone say best use, you have to come for us to prescribe for you. Otherwise, you use it the wrong way, it may not have effect. Because some of them will need to be taken before meal. when they
Okay, so in other words now, the only place we can, people out there can get your
for now, the
products
only
when
place
they
we can get our
comment
product
it.
is here. Our marketing department is at Shongote, what do you call it, Aja complex, but it's not yet open. Currently, we are opening this place because we want to make sure people understand our products before we start going viral. Otherwise, they will misuse them.
Thank you very much, sir.
You're welcome.
Uncle.
And they stay there. And they stay there. And they stay there. Cause all I do is Ludacris going in the sky for the whole that they making my folks locked down. I never went nowhere. What they say is Luda's back. Let me on that contour. The hood call it Luda, yeah. And I'm on this foolish track. So please go. My verse will still be serving. Like a million birds. Last time on a college remix. I'm on the other.
Okay.